Welcome to Medicare 101. Today, we're going to cover the basics of Medicare, who qualifies, what the different parts are, and how to get enrolled. By the end of this session, you'll have a clear understanding of your options about Medicare. A brief history of Medicare. Medicare was signed into law in 1965 by President Lyndon B. Johnson, with former President Harry Truman becoming the first enrollee. In 1972, it expanded to cover people under 65 with disabilities and those with end-stage renal disease. In 1997, Medicare Advantage was created, allowing private insurers to offer plans. In 2003, prescription drug coverage, Part D, was added and began in 2006. In 2010, more preventive services were introduced. Today, Medicare serves over 65 million Americans. Let's start with the basics. What is Medicare? Medicare is a national health insurance program that helps cover medical costs for people age 65 and older, people under 65 with certain disabilities, including those with ALS, Lou Gehrig's disease, who qualify without a waiting period, and people of any age with end-stage renal disease, ESRD. To get Medicare, you must be a U.S. citizen or lawfully present in the U.S., and you must have lived in the U.S. for at least 5 continuous years. Think of Medicare as the foundation of health coverage for seniors and some younger individuals with serious health conditions. It's designed to help with hospital care, doctor visits, and other medical needs as you age or if you qualify through disability. Let's talk about the agencies responsible for Medicare and how they work together. Social Security enrolls most people in Medicare. When you're approaching 65 or qualifying due to disability, Social Security is usually the agency that handles your Medicare enrollment. Railroad Retirement Board enrolls railroad retirees into Medicare. If you worked for the railroad, this is the agency you'd go through for your Medicare enrollment. Federal retirees, premiums are handled by the Office of Personnel Management, OPM. This ensures their Medicare and retirement benefits are coordinated. And finally, the Centers for Medicare and Medicaid Services, or CMS, is the agency that actually administers the Medicare program. They set the rules, pay the providers, oversee the plans, and make sure the program runs smoothly. CMS is the main agency that manages Medicare overall. The parts of Medicare. Medicare has 4 parts. Part A, hospital insurance, covers inpatient hospital care, skilled nursing, hospice, and some home health care. Part B, medical insurance, covers doctor services, outpatient care, preventive services, durable medical equipment, and home health care. Part C, Medicare Advantage, all-in-one private plans that bundle Parts A, B, and usually D, and often include extra benefits. Part D, prescription drug coverage, helps pay for prescription drugs, offered by private insurers. 2 coverage choices. You have 2 ways to get Medicare coverage. 1. Original Medicare, Part A and Part B, with the option to add Part D and Medigap, supplemental insurance. 2. Medicare Advantage, Part C, a bundled plan through private insurers that includes Part A, Part B, usually Part D, and often extra benefits like dental, vision, and hearing. Original Medicare, Part A and Part B, includes Medicare Part A, hospital insurance, and Part B, medical insurance. If you want a drug coverage, you can join a separate Part D plan. To help you pay you out-of-pocket costs in Original Medicare, like your deductible and 20% co-insurance, you can also shop for and buy supplemental coverage. Medicare Advantage, also known as Part C, an all-in-one alternative to Original Medicare. These bundled plans include Part A, Part B, and C. Usually Part D may have lower out-of-pocket costs than Original Medicare. Plans may offer extra benefits that Original Medicare doesn't cover, like vision, hearing, dental, and more. Automatic enrollment in Medicare Parts A and B. If you're already receiving Social Security or railroad retirement benefits when you turn 65, you'll usually be enrolled automatically in Medicare Parts A and B. You don't have to do anything. You'll receive an initial enrollment period package about 3 months before your 65th birthday, or the 25th month of disability benefits, if you're under 65 and on disability. This package includes your Medicare card and explains your coverage and options. Not everyone is automatically enrolled in Medicare. If you're not already getting Social Security or railroad retirement benefits, you'll need to take action to enroll yourself. Here's what to do. Enroll with Social Security either online at socialsecurity.gov or by calling 1-800-772-1213, TTY 1-800-325-0778. You can also make an appointment to visit your local Social Security office. To find your local office, visit secure.ssa.gov/icon/main.jsp. If you're retired from the railroad, you'll need to enroll through the Railroad Retirement Board, RRB, by calling 1-877-772-5772. Let's review when you can sign up for Medicare. If you don't already have Medicare, you have three main opportunities to enroll. Your initial enrollment period, IEP. This is a 7-month window around your 65th birthday. The General Enrollment Period, GEP. This runs from January 1st to March 31st each year if you missed your initial window. And Special Enrollment Periods, SEPs. These are for certain life changes, such as losing employer coverage or moving. If you already have Medicare, you still have opportunities to review and make changes to your coverage. The Yearly Open Enrollment Period, OEP, runs from October 15th to December 7th each year. And if you're in a Medicare Advantage plan, you have a separate Medicare Advantage Open Enrollment Period, MAOEP, from October 15th to December 7th each year. This is the key window to sign up for Medicare. Your initial enrollment period lasts 7 months. It begins 3 months before your 65th birthday month, includes your birthday month, and continues for 3 months after. If you sign up during the 3 months before you turn 65, your coverage begins the first day of your birthday month. If you enroll during your birthday month, your coverage starts the first of the next month. And if you sign up in the 3 months after your birthday, your coverage may be delayed 2 to 3 months. During your IEP, you can enroll in Part A, Part B, Part D, and even Medicare Advantage plans if you have both Part A and Part B, and if you're considering a Medigap policy, your Medigap open enrollment period lasts 6 months starting the month you're both 65 and have Part B. The key takeaway: your initial enrollment period is your best time to sign up. There are no late enrollment penalties if you enroll on time. The GEP happens every year from January 1st to March 31st. This is a 3-month window for people who didn't sign up for Medicare during their initial enrollment period. During this time, you can enroll in Part A, if you have to buy it, and Part B if you enroll during the GEP. Your coverage will start on the first of the month after you enroll. You may also be able to join a Medicare Advantage plan or Part D prescription drug plan if you already have Part A and Part B. It's important to note that if you wait until the GEP to enroll, you may face late enrollment penalties, which could increase your monthly premium. The key takeaway: the GEP is your second chance to get into Medicare if you missed your initial window, but don't wait if you can avoid it. Medicare Special Enrollment Period, or SEP. This is an 8-month period you can use to enroll in Medicare after certain life events, such as retiring or losing employer group health coverage. It starts the month your employment ends or your group coverage ends, whichever comes first. During the SEP, you can sign up for Part A and Part B without facing the usual late enrollment penalties. If you already have both Part A and Part B, you can also join a Medicare Advantage plan, MA, or a Part D prescription drug plan. And if you're interested in a Medigap policy, you'll have 6 months from your Part B effective date to buy one with guaranteed issue rights. The key takeaway: the SEP gives you a safety net to enroll in Medicare after working past 65 or losing other coverage, usually without penalties. Medicare Part A, which is also called hospital insurance. Part A helps cover medically necessary inpatient care in hospitals. This includes semi-private rooms, meals, general nursing, hospital services and supplies, and care in inpatient rehabilitation facilities. It also covers inpatient mental health care in psychiatric hospitals, although there's a lifetime limit. In addition, Part A may cover skilled nursing facility care after a qualifying hospital stay of at least 3 days, if you meet the criteria. In short, Part A is designed to help you with the major costs of inpatient hospital and skilled nursing care. Medicare Part A, also called hospital insurance, helps cover several key services. This includes inpatient blood services, inpatient care at certain religious non-medical healthcare institutions, home health care, and hospice care for those who qualify. However, it's important to know what Part A doesn't cover. It generally doesn't pay for private duty nursing, private rooms unless medically necessary, television or phone services in your room, or personal care items like razors or slipper socks. Understanding both the covered and non-covered services under Part A helps you plan ahead and avoid surprise costs. Most people don't pay a premium for Medicare Part A because they've paid Federal Insurance Contributions Act or FICA taxes for at least 10 years. If you've paid FICA taxes for less than 10 years, you can still get Part A, but you'll need to pay a monthly premium. It's also important to enroll when you're first eligible. If you delay signing up for Part A when you have to pay for it, you could face penalties, your premium may increase by up to 10% and you might have to pay that higher premium for twice the number of years you could have had Part A but didn't enroll. Let's look at what you may pay under Original Medicare. For hospital inpatient stays, you'll have a deductible to meet and then no co-insurance for the first 60 days of each benefit period. After that, there are daily co-insurance amounts for days 61 to 90 and lifetime reserve days after day 90. Inpatient mental health care in a psychiatric hospital is limited to 190 days in a lifetime. For skilled nursing facility care, the first 20 days of each benefit period are covered at no cost to you. After that, you'll pay a daily co-insurance amount for days 21 to 100, and all costs after day 100. Home health care services are generally covered at no cost, but you'll typically pay 20% of the cost for durable medical equipment. Hospice care is generally covered, though you may pay a small copayment for prescription drugs to manage pain and symptoms while at home, and a small percentage for inpatient respite care. And for blood, if the hospital gets it from a blood bank at no charge, you pay nothing. These costs can vary each year, so it's important to check the current amounts before making healthcare decisions. Medicare Part B, also known as medical insurance, helps cover medically necessary services you receive outside of a hospital. This includes doctor visits, outpatient medical and surgical services, and clinical lab tests. It also covers durable medical equipment like walkers and wheelchairs, diabetic testing supplies, and preventive services such as flu shots and yearly wellness visits. Part B can also help with home health care, outpatient physical and occupational therapy, speech and language services, and outpatient mental health care. In short, Part B is designed to help you get the essential medical care you need outside of a hospital setting. Let's talk about what you pay for Medicare Part B. Most people pay a standard monthly premium for Part B, though the amount can be higher depending on your income. If you receive Social Security benefits, your premium may be deducted directly from your check, and for some people, it could be less. It's important to review your situation each year so you know exactly what your monthly Part B cost will be. Now let's look at what you pay under Medicare Part B each year. You'll have a yearly deductible. The amount changes every year. After you meet your deductible, you generally pay 20% co-insurance for most covered services, like doctor visits and some preventive care if your provider accepts Medicare assignment. Most preventive services, like flu shots and wellness visits, are covered at no cost to you. For outpatient mental health services and hospital outpatient services, you'll also pay about 20% co-insurance. Knowing these costs can help you plan ahead and avoid surprises. There are certain situations where having Medicare Part B isn't just optional, it's required. For example, you must have Part B if you want to buy a Medicare supplement insurance, also known as Medigap, or if you plan to enroll in a Medicare Advantage plan. If you're eligible for TRICARE for Life or CHAMP VA through the Department of Veterans Affairs, you'll also need Part B to keep that coverage. And if your employer coverage requires it, typically when your employer has fewer than 20 employees, you must have Part B as well. In those cases, it's always best to check with your employer or union benefits administrator to make sure you're covered. Medicare Part A and Part B cover a wide range of services, there are still many things they don't include. For example, most dental care, routine eye exams for glasses, dentures, and cosmetic surgery aren't covered. You'll also pay out of pocket for services like massage therapy, routine physical exams, hearing aids and exams, and long-term care. Additionally, concierge or boutique medical services aren't included under Original Medicare. However, some of these services may be covered if you have other coverage, like Medicaid or a Medicare Advantage plan. Always review your plan details to see what's included. Medicare Supplement Insurance, also known as Medigap, is sold by private insurance companies and helps fill the gaps left by Original Medicare. This includes costs like deductibles, co-insurance, and copayments. All Medigap plans with the same letter provide the same basic benefits, but the costs may vary between companies. It's also important to know that Minnesota, Massachusetts, and Wisconsin have different Medigap rules. With Medigap, you keep your Original Medicare, Part A and Part B, and you can add prescription drug coverage with Part D. It's designed to give you extra protection and peace of mind when managing healthcare costs. Medigap, or Medicare Supplement Insurance, offers different standardized plans, labeled with letters such as A, B, C, D, F, G, K, L, M, and N. While each plan's costs may vary, the benefits of each lettered plan are the same no matter which company sells it. All Medigap plans help cover the costs Original Medicare doesn't pay, like deductibles, co-insurance, and copayments. Some plans also provide added benefits, such as coverage for skilled nursing facility coinsurance or foreign travel emergencies. Plans K and L have an annual out-of-pocket limit, after which the plan pays 100% of covered costs for the rest of the year. Plan N has small copayments for certain office or ER visits. In short, Medigap gives you options to customize your coverage, fill in the gaps, and limit your out-of-pocket costs, making your Medicare benefits more predictable. The best time to buy a Medigap policy is during your Medigap open enrollment period. This starts when you're 65 or older and enrolled in Medicare Part B. This period lasts at least 6 months and gives you important protections. During your Medigap open enrollment, companies can't refuse to sell you any policy they offer, make you wait for coverage, or charge you more because of past or current health conditions. Although you can apply for Medigap coverage later, your options may be limited and companies may charge more or impose waiting periods. Taking advantage of your open enrollment period is the easiest way to get the best choice and protection. Medicare prescription drug coverage, also called Part D, is an optional benefit available to everyone with Medicare. It's run by private companies that contract with Medicare to help you pay for prescription drugs. You can get drug coverage in 2 ways. A standalone Medicare prescription drug plan, PDP, which works with Original Medicare. A Medicare Advantage plan, MAPD, that includes prescription drug coverage. Part D helps reduce your prescription costs and protects you from higher expenses in the future. You can add it to Original Medicare or certain other Medicare health plans. Let's talk about the cost of Medicare drug plans. Costs can vary by plan and your income level, but most people will pay a monthly premium, and some plans may have a yearly deductible. You'll also be responsible for copayments or coinsurance for your medications. Beginning in 2025, your true out-of-pocket costs will be capped at $2,000, and in 2026 it will increase slightly to $2,100. This limit helps protect you from high prescription drug costs and makes it easier to budget your healthcare expenses. Let's go over how Medicare Part D works. Part D is optional, which means you choose a plan and join, but if you wait too long, you may pay a lifetime penalty. Each plan has a formulary, or list of covered drugs. It must include a range of medications in each category, but the list can change over time. You'll be notified if it does. Your out-of-pocket costs may be lower if you use a preferred pharmacy. And if you have limited income or resources, you may qualify for extra help to pay your Part D costs. To get Medicare Part D prescription drug coverage, you must already have Medicare Part A and/or Part B. For a Medicare Advantage plan with drug coverage, you must have both Part A and Part B. You also need to live within the plan's service area and meet certain requirements. For example, you can't be incarcerated or live outside the U.S. In most cases, you must join a plan to get drug coverage. Waiting too long to enroll can result in a lifetime late enrollment penalty, so it's important to sign up on time. Medicare Part D helps cover your prescription drugs, but timing matters. If you wait to enroll, you may have to pay more each month unless you already have credible drug coverage or qualify for extra help. The late enrollment penalty adds up at about 1% for every full month you were eligible but not enrolled. This penalty stays with you as long as you have coverage, and the amount can change each year. Don't wait. Check your coverage options today to avoid paying more later. When thinking about Medicare Part D costs, it's important to know that each plan has its own formulary, or list of covered drugs. Always check that your prescriptions are covered and see if you can use a preferred pharmacy for lower costs. You can choose a plan and join, but waiting too long without credible coverage may lead to a lifetime penalty. Costs vary from plan to plan, and if your income and resources are limited, there's extra help available to lower your Part D costs. You can enroll in a Medicare Part D plan during your 7-month initial enrollment period when you first qualify for Medicare, or during the yearly open enrollment period. If you get Part B for the first time during a general enrollment period, you can join a Part D plan starting the month after you enroll. There are also other times you may be able to sign up. For example, if you're already in a Medicare Advantage plan, you have an open enrollment period from October 15th through December 7th each year. If you're new to Medicare and currently in an MA plan, your initial coverage election period lets you enroll from your first month of entitlement through the end of your 3rd month. And if you qualify for a special enrollment period or a 5-star SEP, you can make changes then too. Knowing your enrollment windows helps you get coverage when you need it and avoid penalties. Instead of Original Medicare. Most Medicare Advantage plans also include Part D prescription drug coverage in the same card, so your medical and drug benefits are bundled together. Because these are managed plans, you'll generally use the plan's network of doctors and hospitals. Some plans also have out-of-network options, but costs may be different, so it's important to check the details for your specific plan. Many MA plans are designed to help manage costs. Some may offer lower out-of-pocket limits compared with original Medicare alone, and some include extra benefits, things like routine dental, vision, hearing, fitness programs, or transportation, depending on the plan. Let's look at when you can enroll in, or change, a Medicare Advantage plan. First, your initial enrollment period, or IEP. When you're first eligible for Medicare, you can choose an MA plan. During the first 3 months after your Medicare starts, you have a one-time chance to switch to a different MA plan, with or without drug coverage, or go back to original Medicare, again, with or without drug coverage. Next, the Medicare Advantage Open Enrollment Period, or MAOEP. This happens every year from January 1st through March 31st. You must already be enrolled in a Medicare Advantage plan on January 1st to use this window. During MAOEP you can switch to a different MA plan, with or without drug coverage, or disenroll from your MA plan and return to original Medicare. If you do return to original Medicare during this time, you can also join a standalone Part D prescription drug plan. Finally, a special note for those new to Medicare who enroll in an MA plan during their ICEP. Your MAOEP runs from the month your Part A and Part B begin through the end of the third month after that start date. Bottom line, you have specific windows to make changes. Your first 3 months on Medicare, every year January 1st to March 31st if you're already in an MA plan, and a special 3-month window when you're brand new to Medicare. The key is to review your doctors, drugs, and costs before you switch so your coverage fits your needs. When you can enroll in or change a Medicare Advantage MA plan. First, you can join or switch plans during the yearly open enrollment period, which runs from October 15th to December 7th each year, with coverage starting January 1st. If you have Part A and enroll in Part B during a general enrollment period, you can also enroll in a Medicare Advantage plan starting the next month after your Part B coverage becomes effective. There are also special enrollment periods, SEPs, for certain life changes. You may qualify for an SEP if you move out of your plan's service area, gain or lose Medicaid or extra help, or move into or out of an institution like a nursing home. And finally, there's the 5-star SEP. If a plan in your area has earned a 5-star rating, you can switch to it once a year between December 8th and November 30th. The key takeaway: Medicare Advantage offers several enrollment windows throughout the year, but you must act during these windows to enroll, switch, or avoid delays. Let's go over how the health insurance marketplace works once you're eligible for Medicare. First, you can keep your marketplace plan after your Medicare coverage starts, but it's important to know the rules. Once your Medicare Part A coverage begins, you'll no longer qualify for any premium tax credits or other cost savings you may have been getting through the marketplace. This means you'd have to pay the full price for your marketplace plan if you keep it. Next, make sure to sign up for Medicare during your initial enrollment period, or IEP. That's the 7-month window surrounding your 65th birthday, 3 months before, the month of, and 3 months after. If you wait and enroll in Medicare later, you could face a late enrollment penalty that lasts as long as you have Medicare. The key takeaway here is this: enroll in Medicare on time to avoid penalties, and review your marketplace plan to see if it still makes financial sense once your Medicare coverage starts. Choosing marketplace coverage instead of Medicare. In some situations, you can stay on or choose a marketplace plan rather than Medicare. For example, if you're paying a premium for Part A, you have the option to drop your Part A and Part B coverage and get a marketplace plan instead. If you only have Part B and must pay a premium for Part A, you can drop Part B and move to a marketplace plan. You're eligible for Medicare but haven't enrolled because you would have to pay a premium for Part A. You have a medical condition that qualifies you for Medicare, such as ESRD, but you haven't yet applied for Medicare coverage. Or you're in your 24-month disability waiting period and not yet automatically enrolled in Medicare. The important takeaway is that if you don't qualify for premium-free Part A, or you're in a waiting period, a marketplace plan could be an option. But always compare the costs and coverage carefully, because once you enroll in Medicare Part A, you usually lose eligibility for premium tax credits on the marketplace. Medicare offers several programs to help people with limited income and resources. Let's look at the 3 main ones. First is the Medicare Savings Program. This program is run by your state and helps pay some of your Medicare costs. This can include your Part B premium, deductibles, and coinsurance. It's one of the best ways to reduce your out-of-pocket costs if you qualify. Second is Extra Help. This is a federal program that helps pay for Part D prescription drug costs. Extra Help can lower or even eliminate your premiums, deductibles, and copays for prescription drugs. Third is Medicaid. This is a joint federal-state program for people with limited income and resources. Medicaid can help cover costs that Medicare doesn't, like long-term care or personal support services. Some people qualify for both Medicare and Medicaid. This is called dual eligibility, and it can give them broader coverage at a lower cost. The key takeaway: if you're struggling with healthcare costs, don't assume you're on your own. These programs exist to help you afford your care. How to qualify for extra help with your prescription drug costs. Some people automatically qualify. You'll automatically get extra help if you have full Medicaid coverage, receive supplemental security income, SSI, or get help from Medicaid paying your Medicare premiums through the Medicare Savings Program, sometimes called partial dual eligibility. If you don't automatically qualify, you can still apply for extra help. Here's how. Apply online at socialsecurity.gov/benefits-medicare/prescription help. Call Social Security at 1-800-772-1213, TTY 1-800-325-0778. Ask for an appointment to complete the SSA 1020 form for help with Medicare prescription drug plan costs. You can also contact your state medical assistance, Medicaid, office, or work with a local organization like your State Health Insurance Assistance Program, SHIP, for free help. The key takeaway: extra help can significantly reduce or even eliminate your Part D premiums, deductibles, and copays, so it's worth checking if you qualify or applying if you're not sure. Medicaid and how it can help. Medicaid is a joint federal and state program designed to help pay healthcare costs for people with limited income and resources. It's different from Medicare, but some people qualify for both, which is called dual eligibility. While Medicare provides health coverage primarily for people 65 and older or with certain disabilities, Medicaid can cover additional services that Medicare may not cover or only partially cover. These include things like nursing home care, personal care services, and home and community-based services. If you qualify for both Medicare and Medicaid, Medicaid can also help cover Medicare premiums, deductibles, and coinsurance. The key takeaway is, Medicaid offers a safety net for people with lower incomes and can fill important gaps in coverage that Medicare leaves out. Minimum federal eligibility requirements for Medicare savings programs in 2025. Medicare offers 4 main Medicare savings programs to help people with limited income and resources pay for Medicare costs. The first category is the Qualified Medicare Beneficiary Program, QMB. This program helps pay for Part A and Part B premiums as well as deductibles, coinsurance, and copayments. The second is the Specified Low-Income Medicare Beneficiary Program, SLMB. This one helps pay for Part B premiums only. The third category is the Qualifying Individual Program, QI. Like SLMB, it helps with Part B premiums only. And the fourth category is the Qualified Disabled and Working Individuals Program, QDWI, which helps certain disabled and working individuals pay for Part B premiums. Income and resource limits for these programs change every year, so it's important to check the current numbers when applying. The key takeaway: these programs can significantly reduce your Medicare costs, and each category provides a different level of help depending on your situation. Extra Help, also called the Low Income Subsidy or LIS. Extra Help is one of the most valuable programs available for lowering prescription costs, and it's worth applying even if you're not sure you'll qualify. Extra Help can significantly reduce your premiums, deductibles, and copayments if you qualify. If you have the lowest income and resources, you may pay no premium or deductible and have small or even no copayments. If you have slightly higher income and resources, you may pay a reduced deductible and a little more out of pocket, but still much less than standard costs. One of the biggest benefits is that there's no coverage gap or late enrollment penalty for people who qualify for Extra Help, so you're protected from extra costs. Qualify for extra help with your Medicare prescription drug costs. Some people automatically qualify. You'll get extra help automatically if you have full Medicaid coverage, receive supplemental security income, SSI, or get help from Medicaid paying your Medicare premiums through a Medicare Savings Program, sometimes called partial dual. If you don't automatically qualify, you can still apply. You can apply online at socialsecurity.gov/benefits-medicare/prescription help. Call Social Security at 1-800-772-1213, TTY 1-800-325-0778, Ask for the Application for Help with Medicare Prescription Drug Plan Costs, Form SSA 1020. Contact your state medical assistance, Medicaid, office. Or work with a local organization like your State Health Insurance Assistance Program, SHIP, for free, unbiased help. The key takeaway: extra help can lower your drug costs dramatically, so even if you're not sure you qualify, it's worth applying. As we wrap up our Medicare 101 presentation, I want to leave you with some helpful websites you can turn to for reliable information and support. Medicare.gov for all things Medicare, including coverage, costs, and enrollment. Medicaid.gov to learn about state-based programs for people with limited income and resources. Socialsecurity.gov for applying for Medicare, extra help, or checking your benefits. Healthcare.gov for marketplace information if you're under 65 or transitioning from other coverage. InsureKidsNow.gov for children's health coverage resources. CMS National Training Program.cms.gov for training and detailed Medicare materials. And ShipTACenter.org to find your local state health insurance assistance program, SHIP, which offers free, unbiased counseling to help you navigate Medicare decisions. All of these websites are official sources, so you can feel confident the information is accurate and up to date. I hope today's session has helped clarify the basics of Medicare, what it is, how it works, and where you can go for help. Remember, Medicare is a powerful benefit, but it works best when you understand your choices and take action on time. Thank you so much for being here today. Stay informed, review your coverage regularly, and don't hesitate to reach out to these trusted resources for help. We wish you the best as you navigate your Medicare journey. If you have further questions about Medicare, please feel free to call Maria Garcia at 310-926-4229 or send Maria an email maria@mariacares.us. She will be glad to help you through your Medicare coverage options.